I'd now like to introduce Dr. Yelian. He is our talented medical director and specialist in natural and minimal stimulation IVF. Dr. Yelian?
Thank you, Ariel. My name is Frank Yelian. I'm medical director of Life IVF Center. And our center has been set up in Irvine, California for the last 4 years. Actually, next month will be our 4 years anniversary. And I originally came from China, and I finished my medical school in 1983 in China. Then came to the United States in 1987, finished my Ph.D. degree in the reproductive endocrinology, and also later on I was as an embryologist in the Wayne State University, and since then I did my residency and a fellowship and in the REI. And 4 years ago, and I opened the center here in the Irvine. But there's two persons I would especially thanks. One is Richard Duclos, and he was mentor of my PhD program. Another gentleman named Dr. Causey. He's a pioneer for the natural cycle IVF and minimal stimulation IVF. Thank you for being here for this last session and the last day.
All right. Thank you for sharing your background, Dr. Yelian. I'd also like to introduce some of our former patients who have graciously taken their time to speak to you all today and to share their experience with the audiences here. Our first patient is Linda Cousins. Can you please share a little bit about your background?
Hi, I'm Linda, and I've been married for 13 years. My husband, after we got married, we wanted to have children right away, and after 2 years, we noticed something was not happening. And after several IUI procedures, 5 years later, we decided to take a little break because nothing was working. And then after doing a little more research and speaking to our doctor that performed the IUIs, we thought that IVF was going to be our next step to hopefully achieve our pregnancy. So we did our first cycle, and we now, well, I guess quickly I'll just tell you, we became pregnant, and we just celebrated her first birthday in February. So it's been quite a journey, 13-year journey, and to finally welcome our baby girl. It's been a blessing.
Thank you so much, Linda. And also our other patient who's joining us today, Jenny Chow. Would you share a little bit about your background with us?
Yes, good afternoon. My name is Jenny. I was born in Taiwan, came to the States in 1992, and met my husband, my high school sweetheart, when we were 15. Dated until we were 26, got married, and being Asian, we didn't get to start our families first because we were told that we were supposed to establish with own a home and finish our education. So I did that, and when I finished with my grad school at age 31, my husband and I were ready to start a family. But right away I was told that I had really high FSH level. My first blood work came back to be 99 of a FSH level. And then right from there, I was getting death penalties everywhere. No IVF clinics was willing to give me a try, give me a chance. So I was driving to LA. I lived in Irvine, by the way. We have gone to so many fertility doctors, and nobody was willing to give me a chance. Pretty much everybody told me that it was impossible to have my own biological child. So we were thinking about using egg donors, but we stumbled across Dr. Yelian, who happens to be in Irvine, and I didn't know that. So he was our last chance, so we went in, and it was such a blessing. He was different. He was willing to give me a chance. He even encouraged me to try with my own egg. And the result of that, I just celebrated my twin babies' birthday. I have a boy-girl twin. They're 15 months old now, and this journey has taken me 6 years. And I've never been pregnant before this cycle, but I guess God is just amazing.
Thank you so much, Jenny. Okay. In order to have a better understanding of the whole process of what we do at Life IVF Center, I would like to invite Dr. Yelian now to share with us his PowerPoint explaining the differences between natural cycle and minimal stimulation cycle IVF.
So in general, and natural cycle IVF is mimic a natural process. So as you know, in the world, 99% of population, they conceive naturally. Only about 1% really needs help. So many of them, even with need help, they don't need a lot of medication because, as you know, conceive naturally with through one egg, one sperm. Ultimately, this will result the child. So with this philosophy, we believe, and that's the way should create a healthy embryo, ultimately healthy baby. If you have a chance to look at what's the difference between conventional IVF and natural cycle IVF. As you all know, conventional IVF is very effective. It's working, otherwise it would not be existed. So, but with this conventional IVF, people done that, you know, you have to be put you on the 2 to 3 weeks of birth control pill, then put you on the Lupron injection, daily injection, and 2 or 3 weeks later, when you have a period, then the starting of a gonadotropin injection. In general, doctor gives you 300 to 600 units of gonadotropin injection a day. After between 8 to 12 days injection, then when you have 3 or more leading follicles bigger than 18 millimeter size, then doctor gives you HCG trigger shot. So after 36 hours later, then do egg retrieval. On the average, the doctor collecting about 20 to 30 eggs. And one of the patient I saw before who collected 89 eggs in the one cycle. Can you imagine? That's how much impact on the woman's health. In addition, when you have so many eggs, and obviously with the ICSI or conventional culture, and you will create many embryos. But the truth you only need one good embryo to result pregnancy. What of the rest of the embryos, 10, 20, or 30 embryos, what are you used with that? Just for city of New York alone, right now there's about 5 million embryo storage. I believe most of the embryo will never be touched. So it is a major waste of resource. So just for example, and with these injections, you create 10 or 20 eggs, and it was too much. And don't talk about the cost of medication. People done conventional IVF, you know, on average, it probably costs $3,000 to $5,000 in medication alone. And plus, and also have a side effect, such as ovarian hyperstimulation syndrome. People, if you've done that, you may know. And you have to be very bloated, and lots of ascites, and even fluid collection in the lung. So on the other side, with natural cycle IVF, and you pretty much mimic your natural process. And before your ovulation, we using a very fine needle to collecting one egg, and use your husband's sperm, and doing ICSI, and make a beautiful embryo. And either we culture the embryo to day 5, we transfer embryo, and most likely if you're healthy, if you chance of not able to conceive because of tubal dysfunction or male factor infertility, and you have a very good chance to result pregnancy. So another side for the minimum station IVF, and this is another option, which is we use a little bit of medication, which is primarily using Clomid, and using Clomid for, we currently using only half tablets of pill, and taking every day. And when we return ask the patient come back to be monitored once and to see how she responded to Clomid. If she responded very well, that's all medication you need. And most patients, we able to, when the follicle is ready, we can give Lupron trigger, and we're collecting between 2 to 4 eggs. And among these 2 to 4 eggs, with our talented embryologists, we can produce 2 or 3 blastocysts. And this is blastocysts have a very good chance to result the pregnancy. And for that, and obviously, we are not encourage patient to do fresh transfer, because we always like to do frozen embryo transfer, because when we believe when you use a high dose medication, you produce a very high estrogen level, and also the drug side effect of the endometrium. So frozen embryo transfer has a much higher chance of successful. And to dates, and we have several records. As you see, Jenny is one example, and she has the highest FSC level at 99. And last year, we also have a patient who has a baseline, she has no follicle. Her baseline FSH level was 37. At that point, I did not give up on her. I said, come back in 5 days. Again, I checked her FSH level. Her FSH level was 70. She still have no follicles. But we were able to use medication to reduce her FSH. And on the same cycle, her magically developed 2 follicles. And we did egg retrieval and make 2 beautiful embryos. We transfer these 2 embryos. She results a healthy baby. To date, and she's probably the only person who conceived with the biological child at the FSH level at 70 on the same cycle. And this is just a few examples. And also we have another records. And this is a woman and currently set of current records. And she is 47 years old and a woman. She has a married couples and she has 1 daughter already 24 years old. But she has her husband have very successful business. They really want to have a boy. And for that reason, she came to us and we did a 3 minimum stimulation IVF. With 3 minimum IVF, we were able to get 5 eggs and 4 embryos. And then we did a genetic testing of these 4 embryos. And lucky enough, there's 1 embryo was a healthy one. And that embryo was a boy. So we transfer this embryo, results the healthy baby. And that's a picture of the mother, her daughter, and her son. Interesting enough, the mother was born the year of dragon. The daughter was also born the year of dragon. The son is also born the year of dragon, 24 years apart. Thank you.
Okay, thank you so much, Dr. Yelian. All right, so a couple questions for you following that. So can you discuss some of the pros and cons of natural cycle IVF and minimal stimulation IVF as opposed to maybe conventional IVF?
As you see the slides, natural cycle IVF, the pros is because of no medication involved, no fertility drugs involved, and you get we monitor your ovulation, and the prior ovulation, and we give a lupron trigger, and then 35 to 36 hours later, we're collecting 1 egg, and sometimes we do have 2 eggs. And then we're using the sperm fertilizer egg and results the single embryo. And the pros, obviously, because no medication involved, the cost is minimum, and also the surgical time is very short. And on the average, 1 natural cycle IVF egg retrieval time may be only 2 to 3 minutes. And and also patient will be very less stressed, and the margin is very minimum. And also our company has a policy: if we do egg retrieval, if an egg did not collected, does not count as cycle, and we move on. So in terms of besides natural cycle IVF, and the minimum stimulation IVF has an advantage because you use a little bit of medication, and you can produce 2 to 4 eggs. And also because of the chromium used, and also less likely to be pre-ovulation. So we have a better time control. So overall, by both methods, and it can be very effective for a patient. And natural cycle IVF more usable for younger women. And for example, if a woman has particularly have a tubal dysfunction or the male factor infertility, that's our second choice. And also it's a very good choice for the woman who has over 40 years old and have very poor ovarian reserve. Sometimes FSH level scar head, like 30 or 40, even 50. And this is a good cycle for natural cycle IVF for this patient as well. Only downside I can think of is because of a natural cycle IVF, you are not use medication, you only have a single egg. So because of that, and overall, the pregnancy rate per cycle may not be as good as a conventional IVF because you produce 20 or 30 eggs and you have more choice. But if you are doing 1 or 2 or 3 consecutive natural cycle IVF, your accumulated pregnancy rate almost the same as the conventional IVF. For the minimum stimulation IVF, I cannot think of any major side effect. The only thing I could think of is because of using clomid, we usually do not transfer on the same cycle.
Okay, thank you, Dr. Yelian. At this time, I would like to direct your attention to our gracious former patients who have so kindly joined us here to share more about their personal experiences and how they used natural cycles to create their joys in this world. Linda, would you please share with us about your cycles?
Yeah, absolutely. As I mentioned earlier, we did, my husband and I were doing a lot of IUIs. And I was under a lot of medication for that. And like he explained earlier, that can cause you to ovulate many eggs. I think one of my last cycles, I ovulated over 20. And it took a toll on me and my husband because he was under medication as well, because our situation was a male factor. So they wanted to increase his sperm count. So he was on Clomid, and then they put me on Clomid on top of injections to, improve my chance to get pregnant as well. And it was I want to say it was around 5 cycles. So in each cycle, we would do 2 IOIs. I would go in one day and then the next day just to kind of increase our chances. By the 4th or 5th cycle, which was our last one, I was very bloated. We had gained a lot of weight from all the medication. I got to the point where I was very depressed. I was suicidal. And it was because of all the medication I was under. And so we stopped. We decided to just take a break. And that was about a 2-year break. And then we kind of brought up the chance of maybe looking into adoption or maybe IVF. And when we were doing the research, we also stumbled upon Dr. Yelian and on the internet and looked at, he had a free seminar, so we went in, we joined in and learned a lot about our situation, which we have no idea. We just went in, doctors did what they needed to do, hoping that I would get pregnant without even knowing me, not being educated. I come to find out that I also had endometriosis, and Dr. Yelian actually diagnosed me with that later. And when we discussed about the possibilities of doing IVF, he suggested the minimal stimulation. The difference between that time, when I was doing IUIs and I did my first IVF cycle, I felt no side effects because it was, I want to say, 1/3 of the medication I took. And my husband didn't take any medication. And we were able to get 4 eggs, I believe. And no, actually 5 eggs from that. And we got 4 beautiful embryos from that cycle. And our first transfer, it was unsuccessful. So we decided to try again the following cycle. And that's when we got pregnant with my daughter. But again, I want to just reiterate that the amount of medication, I still can't believe the difference that I felt with my body and not feeling that the pressure of what's going to happen if I, if I end up suicidal again, like what am I going to do, And so I guess that's all I can say, It was a very good option for us.
Thank you so much, Linda. And also, Jenny, if you could share with us your cycle treatments and what you went through at Life IVF as well.
Okay, like I shared earlier, I came to Dr. Yelian we started the ball rolling already. I was waiting for the egg donor to come back from her vacation. So then we could start with our egg donor process. And I saw Dr. Yelian's commercial in this Chinese channel that one time, and then he offered a free seminar with a free drawing of 1 natural cycle. So that drew me there because we are running out of money. So I was hoping that I would go, and nothing he shared was I haven't heard, So he went on and on about this whole process of how IVF works, and I was just waiting for the end that we could have the drawing. Of course, I didn't.
I think we all did that. Like when I saw free drawing, I'm like, oh, let's go.
I have heard enough of FSH, and I truly, until this day, hated those 3 letters because they gave me a label. Everywhere I go, people would look at me and go, "Oh, 99. I'm sorry, you're not a good candidate in our department." I've gone to as far as USC fertility, this and that. It's just everybody closed their door. And then I looked at those doctors' faces like they're playing God. They tell me if I have a chance. You could have a kid or you don't. And they highly promoted egg donors, like it's just selling Toyota and Honda. It's no difference. But to me, that is a major difference because I would look at this kid and see no reflections of me, and maybe some of my husband. He's glad, but. So anyways, I came to Dr. Yelian and was only hoping that he would tell me the honest truth. You know, we prepared $40,000 at that time for that conventional egg donor cycle. I asked him, I looked at him, his face, and he, Dr. Yelian, I don't know you, but you're Chinese. Tell me, I'm Chinese too. Tell me the honest truth. Should I just move on with the $40,000 with my husband and have a wonderful life? Because we already spent so much money here and there, just the consulting, even though I didn't get any treatment, nobody wanted me. But still, the consultation cost a lot of money. It's $400 here, $300. We're spending money that we don't have. But still, just the urge to have a child, because I teach young kids, I'm a teacher. I feel like it's impacted my whole life, because when I'm teaching, I look at kids. When I'm not teaching, I think about kids. And it's just, it hurts every second of my life. I open my eyes and go, God, how come I don't have kids? So anyways, he told me that he took when I asked him, just tell me if I should proceed with this or should I just keep my money and go travel the world with my husband. We met at 15, so we certainly got along really well. So Dr. Yelian took 30 seconds of awkward silence, and I was so certain that he was going to say, yeah, just take your money and enjoy your life. But he said, I see you have this much money. And I was like, oh no, this greedy Chinese. He said,
Not enough.
he said, but before you go proceed with egg donor, can you please let me try with your own egg? And that made me feel like, excuse me, come again? What did you just say? You want to try with my own egg? Are you sure? Because nobody else wanted me. So he did. We started 2011 when I was 34. I was diagnosed with high FSH when I was 31. So 3 years I went back to Taiwan, did one conventional cycle, and where else in USA nobody wanted me. So we were looking into other options, adoptions, egg donor. He said, so we started with him. I had 6 cycles total with him. None of them has drugs because a woman like me, drugs would not work. So so I had some failing cycles, of course. He's not a magician. So 3 complete cycles because of high FSH, 1 early ovulations, and every cycle I'd be blessed with 1 follicle. I never had more than 1 and 1.5 probably. That little one was underdeveloped. And it hatched all the time, but it just never fully developed past day 3. So I had 1 blastocyst, which I was really happy with, but unfortunately I wasn't pregnant. So by the last cycle, I told Dr. Yelian, you know what, you tried your best, and I know you know I have this much money, and he's so good with not spend it all. So I told him, I know it's just me. I know it's not you. Okay, let's proceed with egg donor. Let's not make you go bankrupt. Continue trying on me with the little money that I have. So that's why I resulted in twins, not because they're from the same cycle. 1 was frozen embryo, but because my number reading for the month was not good, the rest of a FSH and all that together was not good. So I had 1 frozen embryo, and 3 months later, I had 1 fresh. So, and because I had so many failing cycles, I told him that, you know what, just dump it in, the both of them. That save some money, save some transfer fee, you know. So he did. I was not hopeful at all because it was like a roller coaster. But when I found out, I went back for a pregnancy test, I looked so cool. Like, oh, you know what, it's okay, negative, it's fine, you know, I'm so used to it, I'm fine, because I already made friends with live IVF people. I'm a usual, I would say. So I told them that I'm fine, just tell me it's negative, and then we'll move on. Next week and next month will be a donor. But when they came back, they told me my reading was good, and it was 300, I remember. And the second time I went in 4 days later, it was 3,000. So they told me that I could have, one of my friend in the lab already told me, you could have triplets. I'm like, you gotta be kidding me. And they say, well, sometimes they split, embryo split. So I'm not a doctor, I don't know. I'm like, no, God, please, I don't have money for that. So, so resulted, I have a boy and a girl twin. They're 3 months apart, embryos, but now they're twins, they have the same birthday. So natural IVF is my only hope, and that made me complete my family. And I'm 37 now. My babies are 15 months old. Thank you, Dr. Yelian.
Thank you so much, Jenny.
Thank you. Actually, another side story, which is she did show me. She said, I have $40,000, and the sum of money was from my mortgage and refinance. I told her at the time, I said, I don't want you to spend all the $40,000. I offer you a guarantee program. Spend $30,000. If I try self-cycle with your own egg first, if at the end I still cannot get pregnant with your own egg, I would like to pay for your donor egg IVF with the $30,000 total. Save the $10,000 for your baby. That was I told her.
That helped. Now I have twins.
I want to truthfully.
Well, thank you both, Linda and Jenny, for sharing your time and your experiences with us. At this time, I'd like to turn this over to the audience, actually, for any questions that you may have for our facility or for the panel.
Yeah, hi, thank you. I have a couple questions and maybe everyone will benefit. So I'm trying to understand how this works better for an older woman or high FSH. It sounds like you just kind of more patiently wait with less follicles to kind of collect more naturally and monitor and see how those look. Is that kind of more or less?
So for the woman over 40 or over 45, and the overall, especially their FSH level very high. So when your FSH level high, we all know FSH, the function of FSH to stimulate follicle growth. And each woman's FSH level threshold to let the follicle grow are different. Some women FSH level maybe 5 or 7, and their follicle can grow. But some women, I have seen a woman yesterday, and her FSH level 57, her follicle is still growing. So what that means, each woman's threshold for follicle growth are different. So we have to tailor each patient to know what is the best FSH level for her to result her follicle growth. So we have various different maneuver, including medication. We can adjustment her follicle, her FSH level to make her follicle grow. So to answer your question, when the woman is older, and since she only have very few follicle left, and if her FSH level very high, so you are not giving her more medication. You try to reduce her FSH level, make her follicle grow. That's the key. So this is for a woman like 47, one example, woman 47 years old, and she only have one follicle, her FSH level 35. In this kind of high FSH level, if you give her Clomid or you give her gonadal chopping, and her FSH will be reached sky high, and her all follicle will disappear. For those women, you have to reduce her FSH level, let her follicle grow.
Yeah, I was going to say the same. How do you do that?
That's the magic. So we all know, very simple actually. The FSH level and the estradiol level are opposite function. So especially when you are using FSH, follicle stimulation hormone, you stimulate follicle growth. When the follicle grow, then follicle produce estradiol. So when the estradiol go for higher, and they have negative feedback to the brain, and then depress of your FSH secretion. So your FSH level come down. So both estradiol and the progesterone have a similar function, can reduce your FSH level. So that's the medication, a magic medication.
Okay. And anyone else with any more questions? Okay.
Thank you so much for your talk and inspiring patient stories. It's wonderful to hear. I'm a fertility physician as well, and I've tried minimal stimulation on several of my patients. What I notice is it works great for some patients, but for some it doesn't. Obviously, it depends. My question to you is, how many cycles do you do in terms of how many embryos, and which stage do you freeze them at before you decide to thaw them and put them back?
That's a good question. Thank you for being here. And that depends on a woman's age. So if a woman younger than 35 years old, and usually typical one cycle of minimum stimulation IVF, we can create about between 2 to 4 eggs. And we always using ICSI to fertilize. And thanks Molly, she's sitting back. She's our talented embryologist. And her ICSI fertilization rate is 98% average. So because we only have 1 egg or 2 eggs, we need this embryologist to make this egg fertilize. And so after fertilization, and we always culture embryo to blastocyst. So we believe if embryo cannot make blastocyst, those embryo transfer most likely will not result in pregnancy. Although sometimes chance of day 2 or day 3 can result in pregnancy, but those embryo, if you culture in the vitro, those embryo can make blastocyst as well. So we always, by default, culture all the embryo to day 5. So if woman older, over 40 years old, and usually I encourage them to do 3 cycle package. We have a very nice 3 cycle package. So hopefully each cycle we can collect in between 2 to 4 eggs. And each cycle we can make 1 to 2 blastocysts. So at the end, about 3 cycles, hopefully she have 3 to 4 blastocysts. Because I believe as a woman at 40 years old, among 4 blastocysts, you should have 1 embryo can result in live birth. So that's in general. So that's our strategy.
Thank you.
Okay, any other questions?
Do you notice if there is a difference in the quality of embryo, whether it's conventional IVF or minimal stimulation?
Since we don't do conventional IVF in our center, and our center is 99% of the IVF we're doing natural cycle IVF and minimum stimulation IVF. So we don't have a head-to-head comparison. But there's one case I can share with you. There's one patient, and she's currently pregnant with minimum stimulation IVF. That woman who has been working with us for a pretty long period of time, and during her multiple cycles, almost each cycle we can create 1 or 2 embryos, and sometimes embryo make blastocysts, sometimes does not make blastocysts. And after 2 or 3 cycles, she feels so boring, and every cycle we did not get too many embryos as she wished for. And she did not tell me, and she worked in some other fertility center and did a conventional IVF. And she injects lots of medication, get 19 eggs. She was so happy, but at the end, 0 blastocyst. I cannot say this is always the case, but in general, we believe the less medication, the egg quality is better. I always believe the medication, the fertility drug, just like a fertilizer. So if you're growing flower, you need some fertilizer. But if you pour whole bunch of fertilizer in the soil, I guarantee the flower will be dead. The same concept apply everywhere.
When would you recommend to somebody like getting the testing, the genetic testing?
So in general, as I said, the woman over 35, by American Society of Reproductive Medicine, they recommended to do certain type of genetic testing after you retrieve pregnancy because the chance of a baby has Down syndrome increase. So in general, I would recommend a patient to consider genetic testing of embryos, especially those women has multiple embryos to choose from. And if women over 40, I strongly encourage them to do PGS because that's the way not just increase the chance of pregnancy, and also reduce the chance of miscarriage. We have our own data. We did a study. In our center, cross-board, and the last year alone, we did 2,000 IVF cycles. For all the patients, we did, in general, cross-board from age 25 to age 50 years old with their own eggs. For those women, of cross-board, the pregnancy rate is about 46%. But those women, if you did genetic testing, especially PGS24, which is check all the chromosomes, the pregnancy rate is 70–80%. Just pregnancy alone say something, means if you do genetic testing, you can get rid of most of abnormal embryo. The overall chance of success will be much higher.
I was wondering if you do your egg retrievals under anesthetic, under general anesthetic still, or not? Or is it a personal thing for the patient?
Yes, and in our center, and for all the egg retrievals, I would say 95% of egg retrieval, we do not do any anesthesia. And about 4%, we offer local anesthesia or Vicodin or the Valium for the oral sedation. And only 1%, they put them to sleep using IV sedation. However, we do offer all the patient options. So if you do prefer to do IV sedation, you can get it. But I believe, because especially with natural cycle IVF, the egg retrieval time per follicle, 1 minute. And among this 1 minute, the only painful period, only about 1 to 2 seconds. Only like the needle puncture, this 1 second you feel pain. During aspiration of fluid, no pain at all. And another pain is another second when the needle come out. That's all. They're very similar to the pain level of the jaw blood. So I don't believe anesthesia is necessary.
Okay, any more questions?
Sorry, thanks again. How easy is it for international clients to come over and do that?
So for all patients at the present time, and just last month alone, we had 278 egg retrievals. Among these 278 cases, we have about 1/3 is out of state, and 1/3 is out of the overall the country. So far we have patients from Russia, France, UK, Germany, South Africa, Holland, all over the country, China, not us, and Japan. So the people from outside of the state of California, outside of the country, what we usually do is we do Skype consultation, and the patient can be local. Then if we start in the cycle, they monitor locally. And we locally monitor, and for the patient, they are, especially after the first cycle, they can do injections locally or taking oral medication locally. Then we always continue to monitor them, and when the follicle is ready, we give them a trigger shot, then they fly next day, stay 1 night, then do egg retrieval, then fly home next day. So most patients stay here only 1 night. Obviously, for international patients, they would stay in Southern California for beautiful weather for longer. That's a perfect option.
Okay, any more questions? Oh.
You said something about medication and a little the uterine lining and estrogen. I didn't totally catch that, the kind of pros and cons of the high medicated cycles versus what you guys do. Could you speak on that?
That's purely to discuss about the fresh embryo transfer and the frozen embryo transfer. And I believe because of for the medication, and especially for the minimum sedation IVF, and the primary medication is called Clomid. It's also clomiphene citrate. This medication have anti-estrogenic effect. Because of this effect, can let the brain to produce more FSH, so stimulate follicle growth. And at the same time, because of this anti-estrogenic effect, so this acting on the endometrium can make lining thinner. So because this, for the minimum sedation IVF, I usually do not recommend for the fresh embryo transfer. And also, because of the same cycle, and you use such a high dose medication for the conventional IVF, so your estradiol levels are sky high. Because of this, and the environmental for the embryo transfer is not suitable. So this is why for the more recent studies, and the more doctors switch to the frozen embryo transfer than the fresh embryo transfer.
Okay, I saw that.
Hi, I'm Ariel, and I'm your actually patient for the second cycle. And I've done 4 conventional IVF outside of your clinic before, and nothing made it. And with your first cycle, I had 4 BB, which was a blastocyst. So I made it to freeze, which is my first time in my experience. Thank you. And then this cycle, I had 4 AA. So that's a miracle for me, and it's been frozen right now. And you were saying that you have a lot of patients from out of town and out of the country. That shows that you have a doctor who does minimal stimulation cycles, protocols are very limited here in the States. How come there are not so many doctors who recommend this minimal IVF cycle, even though it seems like it's working for me and it's a miracle for me?
I would like the doctor sitting behind you and let her to answer that question. Yes.
See, I happen to be one of the ones that does try new things because I'm not so far from fellowship. So what I've noticed is that the younger doctors, I think, try new things. So I have tried minimal stimulation protocols. And in fact, I have a patient, my partner actually is out on maternity leave, and she had this patient that would only make 3 to 4 eggs. And she came to me and she had 20 follicles. And I said, well, why don't we try minimal stim? And so I gave her actually Clomid with 150 of FSH. I mean, I didn't do a completely natural cycle. And we did her retrieval yesterday, and she had 19 eggs. 19. And that was amazing. And she had never had more than 3 or 4. And that was a very low dose of meds for her. And she had 11 that fertilized this morning, so that's really great for her. So I do try it. I've tried it in a few patients and have been disappointed with it, but I've been trying in other patients and been really happy with it. So I never do everything for the same, same protocol for everybody. I think you have to individualize.
What are the reasons that they don't recommend it so much?
Because I think a lot of patients don't respond to minimal stim. It depends. I think it's very individually. But I mean, you obviously have more experience, so that's why I'd love to learn more about it. And as I said, I have tried it, and I know there's so many different types of protocols, like Clomid with shots or Clomid with shots every other day, and it's very varied. I just haven't found the one that responds for everybody in my patients.
Thank you. And to answer your question, and because of especially natural cycle IVF is not easy. And it's a very challenge, especially because of we so-called natural cycle IVF, which means that we have to follow your follicle physiology. So whenever follicle ready, we have to go to egg retrieval. So that means we have no weekends. So for the fertility doctor, no weekends probably is no. They want to have a schedule. They want to batch in your cycle to put your birth control pill for 2 to 3 weeks. Not all for you, for them as well, because they have a timing, have their vacations. But for us, if you do want natural cycle IVF, you can do that, because which means we have to do egg retrieval all the time. Tomorrow morning, Sunday morning, I have an egg retrieval at 11 o'clock, already booked. That's one of the reasons, because it's not a convenience, and also very, very challenge. And I give a talk at the American Society of Reproductive Medicine last year at Boston. My topic was about the natural cycle IVF. Why is so few doctors in the United States doing natural cycle IVF? One is the challenge is because of at the fellowship program, no fellowship program teach you how to do natural cycle IVF. The fellows has not been trained. If not because Dr. Cado, which is the gentleman I just mentioned to you, and he is my mentor. I spent 3 months in Tokyo, studied all the details about natural cycle IVF. Without him, I would not be here, because I just trained like other doctor, and we do all the conventional IVFs. So natural cycle IVF needs lots of training, because it's so difficult, because follicle, when you see it today, and a few hours later disappeared. You have to have knowledge, and you have to understand the follicular physiology very well, and besides dedication. And also key thing, you have to have like a Molly as embryologist, extremely dependent on the lab. If you have a poor lab, you have a 70% of fertilization rate of ICSI, then you cannot do natural cycle IVF. You need, when you give her egg, she have to give you an embryo. That's kind of lab you need to. And the minimum station IVF is the same. And because you already dealing with very few eggs, so you need to have a very, very good lab to be functioning. And because of minimum station IVF, and also use less medication, and you have to be very dependent on your lab can give you good quality embryos. Otherwise, they will not be successful.
Thank you very much, Dr. Yelian. At this time, I would like to let you know that if you'd like to learn more or contact any of our speakers today, you can visit www.fertilityplanet.com. You can also watch all video sessions available on their website for free. You can also follow fertilityplanet.com on Twitter or Facebook for news and conversations about today's sessions. Thank you to Fora.tv for your live streaming and recording of the programs today. Thank you to Dr. Frank Yelian at Life IVF Center for being here today and sharing your expertise on this topic. And to our former patients from Life IVF, Linda Cousins and Jenny Chow, thank you so much for sharing your experiences and spending your time here with us today. It was truly a pleasure. And thank you to the sponsors of this session, Life IVF Center, for supporting this conversation here on natural cycle IVF and minimal stimulation. And finally, thank you to our audience for joining us here today. I hope you truly enjoyed this conversation, and we look forward to hearing from you.
Thank you.